Oral intake is the most desirable and appropriate method for obtaining nutrients. But there are patients with a functional gastrointestinal tract who are unable or unwilling to ingest oral nutrients. In these cases, enteral tube feedings are an alternative. The feeding tube may be inserted surgically, as shown here, or the nurse may insert a feeding tube into the stomach or small intestine as part of the patient's nursing care. This program demonstrates skills the nurse uses to administer enteral nutrition. These skills include feeding tube insertion, administration of enteral feedings, feeding tube irrigation, and feeding tube removal.
My name's Rick. I'm your nurse. How are you this morning?
To help you place these skills into context, you will meet two patients. Mr. Collier is being treated for a draining wound, and he requires increased protein for wound healing. Intermittent enteral feedings have been ordered.
Mrs. Devon, I'd like to check your eyes.
Mrs. Devon has an undiagnosed neurological disorder.
Look straight ahead.
She is unable to maintain an adequate nutritional intake. Mrs. Devon is receiving continuous enteral feedings while she undergoes occupational and physical therapy, as
Now,
well as a re-evaluation of her
grip my
care
fingers?
needs. Remember, as you provide enteral nutrition, you need to prevent pulmonary aspiration, plan individualized care and patient education, collaborate with the healthcare team to ensure continuity of care and accurate and timely communication. Apply critical thinking in decision-making and evaluation of the effectiveness of nursing care. Also, perform the skills with care and compassion because enteral nutrition may cause discomfort and embarrassment. Delegation is an important consideration in planning your nursing care, as agency policy may permit assistive personnel to administer tube feedings by syringe or by continuous infusion. However, assistive personnel should never insert a feeding tube or be asked to verify tube placement. Be sure to communicate clearly when you are delegating specific tasks. Clarify the type and volume of formula to be administered and the rate of infusion. Reinforce the importance of having the patient sitting up in bed or in a chair during feedings. And have personnel report any difficulty in administering the formula or any discomfort expressed by the patient.